Hello and welcome to the Max Your T podcast, the Testosterone podcast. Good to be here. Katy Draper, sports broadcaster in the UK. More importantly, got two doctors on the call who happen to be married. The protagonist of the story, Dr Max Draper, and his wife, Dr Katy Draper. How you doing, guys? You all right today?
Yeah, we're good. How are you?
Yeah, great.
Very well, thank you. Very well. So what we're going to do during the course of this testosterone podcast is dig into lots of different issues, but as it's revolving around your story, Max, I suppose what we're going to do in this first edition is discuss how you were trundling along relatively well in life, how you had a bit of a crisis, and how it was connected to testosterone. So I guess this is the first part, which is probably quite a challenging conversation, been for quite a bleak time. But just tell us, I suppose the start point of this is where you were in life when things hit, namely, chiefly testicular cancer, wasn't it? So how long are we going back here?
About six and a half years ago.
Yeah.
So and then following that, the illness or the whole picture developed over a period of sort of years, basically, culminated about 3 years ago.
Yeah.
So you were working as a GP living in Newcastle 6.5 years ago. So how old were you? 30, 31, something like that, were you?
29.
29.
Yeah. So but it was quite a sort of a lead up to it, in essence. We'd had a few miscarriages, ectopic pregnancy. And then when Katy, when things were looking good, I got diagnosed with cancer sort of early on, wasn't it? About 12 weeks.
Yeah.
When you were 12 weeks pregnant.
Max went for a scan on his testicle to find out he had testicular cancer. I was having my 12-week scan with our daughter Lola and find out. So I had like good and terrible news all at the same time. It had taken us quite a while to get pregnant with Lola. So it was very turbulent time, to say the least, wasn't it?
Do you think the stress? I mean, the whole issue, the whole sort of time. It's quite amazing that you got through that period. But do you think that had a residual effect on the testicular cancer? Because you actually dealt with it quite quickly, though, didn't you?
Yeah, I had surgery within 2 weeks and was recovered within 6. I think I was off work for about a month, 6 weeks, something like that.
Yeah,
and I got back into it because it's actually not a massive operation in terms of recovery and things like that. It's almost like probably a more mild version of a hernia repair. Almost, it's a very similar area. They go in through the groin and you recover quite quickly.
So you had the testicle removed, did you?
Yeah. And that was really.
So after that 6 weeks, how was life after that period? Then you felt better pretty immediately.
Oh, yeah, I didn't really feel particularly unwell being diagnosed. It was purely sort of a lump and then get it checked. Bit of umming and ahhing whether they thought it was anything dodgy. And then ultrasound confirmed it, which was a bit of a shock. But I wouldn't say it was too bad physically or mentally, really. And this is what's funny about the low testosterone and getting ill from low testosterone is I've never really been that fussed about. I've always sort of been fairly laid back and sort of just go with the flow a little bit, which is what changed when I became ill with what turned out to be low testosterone. So that's it was uncharacteristic, I would say.
Yeah, you must have been going through a lot of stress, Katy. What was that like for you? Did you feel Max was okay after that initial operation?
Yeah, Max, when he first got the diagnosis, obviously we're really, really worried, thinking what's going to happen, what's he going to need, is he going to need to have chemotherapy? It's all of the questions, all of the uncertainty. I remember when he went in for the scan and I still didn't really think it was going to be anything, and it was because he was so young, although testicular cancer does tend to be in younger men. But so that was a shock, but then I think the pregnancy distracted us as well, and then you have a new baby, and I think Max does tend to just deal with things like quite well, and we talked about a lot. We used to go on loads of walks by our old house, and we used to talk through everything and what was going to happen, and we had like excellent NHS care, excellent doctors, and really good support. So the testicular cancer actually was really looked after really, really well. When Max became unwell, which was a year or two following the cancer, initially I thought maybe he didn't deal with the cancer. Maybe this is what, because the initial presentation for Max was severe anxiety. And I thought maybe we've had so much trauma and loss, not just with Max's cancer, but we've had miscarriages, that maybe it's all just now, this is the time, and Max has just hit a wall with it. And so that was my initial thought. And that period of time was 100 times harder for us than any of the rest of the time. And I think that's why we're doing this, because low testosterone really can ruin a man's life. And we just want people to be able to understand what the symptoms might be, and that it's very treatable. And it doesn't necessarily have to be following something like a testicular cancer to have low testosterone. So I think that's the basis of why we're here, because that time was hell compared to anything else we've been through.
Yeah, no, it's a massive challenge for the family, but that gradations, Max, you had the testicular cancer, you had the testy removed. When you look back, was there a gradation in symptoms? Because you had that other sort of cataclysmic event, didn't you? You had a meningitis at one point, is that right?
Yeah, I would say that the symptoms, probably looking back, were sort of like a year after the surgery, potentially. You know, a little bit of tiredness, a little bit of anxiety, a little bit of sort of irritability.
But you also had a baby as well that is challenging for that. Yeah.
That's the thing. And I think that's the thing about a lot of diagnoses, isn't it? It's the fact that there's always confounding factors. It's never, oh, I've got this symptom, so it's this. Well, you could put it down to the fact I'd had cancer. I had a new baby who wasn't sleeping very well. You know, there's stress with being new parents. You know, I had what a lot of people would perceive as a stressful job, being a GP. And so there were sort of factors involved there that you could say, well, you're just working too hard, or you're burnt. You know, what I suspected was a burnout, but in hindsight, you know, burnout is probably much higher risk occurring to you if you have a significantly low testosterone.
Yeah. Did you notice it one time, Katy, or was it just a gradual? Because it's difficult to determine, isn't it? Because you adjust to what the switch and normal becomes what's the next day, and it's hard to know. Did you suddenly realize how far Max had deteriorated from where he had been in terms of energy and vitality?
There was a point in time when I knew he was really, really unwell, but leading up to that, and that was at the Christmas when everything just came to a head, but leading up to that, like Max said, we had Lola and she didn't sleep, and I was anxious because I was a new mum and I was worried about everything. And, you know, you think, oh, I'm a GP, I should know things. I mean, I was doing things like thinking I needed to take it to A&E because she had a temperature, and you know, being completely sleep deprived and not being easy because it was hard, and it is hard. And again, feeling like you don't have a lot of support when you're first time mum. That's how I felt from like outside. I didn't have a lot of friends who had babies at the same time. You guys lived close to us, so it was it was difficult. So
you abandoned us in the northeast.
Yeah.
So so I thought, you think that as you go along, I thought, well, yeah, of course Max is going to be stressed. He's working full time.
Yeah.
He was coming home from work. Lola would cry, and he'd get home from work and I'd be like, please take this baby. Like, I need to rest. And he just worked all day. And I remember, because we didn't have a dishwasher, and I'd leave all the dishes, and I'd be like, I can't, I need you to do that.
The thing is, you were still very young, but there's also a perception. You don't know, you only kind of live life once, so you don't know what the normal aging process is like regarding things like energy, do you, Max? That's the kind of thing that you're not quite sure what's normal to feel if you get older.
Massively. And the thing is, as well, is how much, you know, could you put it down to I wasn't getting a lot of sleep, and things like just personality traits that I've always had, which is like, you know, I'm quite exercise obsessed. So, you know, I was doing some form of exercise every day. And in hindsight, I thought, well, maybe, you know, and actually I was told this by one of the cancer specialists in follow-up, because I said, you know, I'm tired all the time. I feel like a bit irritable, and just, you know, I didn't really go into sort of mental health with them, and they were like, did the bloods, and in hindsight, back then my testosterone was not great, potentially treatable at that time, and that was before I really hit a wall.
How long? When was this? How long ago was this?
Probably about 4 years ago. It was probably about a year before I got really ill. As in, ruined basically. But so I look back and I was literally told, well, you're working full time, not GP full time, which is not full time to most people, but it's full time to us. You're working.
But it's also, that's hours on site, but there's also a lot of residual stress, concern for other people, isn't there? And a high pressure in that sense that you have to get it right. Presumably.
This is the thing. I always left it there. I really never took work back with me mentally. Did I really? I mean, it's never been something I've done.
I do that. He doesn't do that.
No. Well, that's good.
Fairly confident to leave it there in terms of clinically and things. A few things upset you in terms of, young patients with illness still get me now. But I never really found the job too stressful. But it seemed like what I was being told was, this is a burnout because you've been stressed, you've had cancer, you've been sleep deprived with a new baby, that's stressful, and you exercise too much, which in hindsight, I didn't really exercise too much. I exercised probably...
Yeah, because the frequency was high, but your intensity wasn't savage particularly, was it? It was just kind of maintenance, ticking over stuff.
No, and I'd have rest days and, go for walks and things. It wasn't like I was doing 2 sessions of weight training a day and running marathons or something like that. It was very sort of light, hypertrophic exercise, I would say, with some jogs.
I think for me, though, what he was doing is everything he's always done his whole life. So this was nothing new. He wasn't doing anything more than he's always done.
Yeah.
So Max has always been a person who's been up early. He's always exercised. He's always had a lot of energy, like you all do. All the dreamers have a lot of energy, don't you? He's
high tea.
Well, hopefully.
The change for Max was very significant because it wasn't anything like his personality. So yes, all of those things in anybody could cause burnout and cause stress. But that wasn't Max's personality. So it started to click with me that something else was wrong.
Yeah.
I couldn't work out what it was at all. And I never thought it was testosterone because that wasn't even in my head. And
no.
It shouldn't be.
But also you conceived a second child, didn't you, around this time? So that's Henry. So actually that doesn't, people, I guess, anecdotally or maybe just off the cuff wouldn't think, if someone's conceived a child, their testosterone wouldn't be a problem. Is that something that you thought as a doctor, that I'm fertile, so maybe testosterone wouldn't be an issue? It's not a connection to make. Would that throw you off a little bit?
Not necessarily. So I obviously now I've become sort of a TRT doctor. I know about the sort of sperm side and the link with low testosterone, but there is, if you have low testosterone, you are more likely than the average man to have a low sperm count. Let's put it that way. But they're not.
Yeah. All I mean is, all I'm trying to sort of explain is why you maybe didn't jump to that conclusion straight away. Maybe why people in a similar situation would think, actually, I've just had a baby. So, you're looking at the variables and what's changed, and you're thinking people are saying it's not work. But you wouldn't necessarily think, or other people might not think, it's testosterone because you've just conceived a child.
Yeah, I suppose you'd think testicular function, it's still going because I'm making babies. But I would say it's far more deep than that. Hence, our desire to do this, which is a complete sort of lack of knowledge and awareness of testosterone and the effects. That's what we've spoken about before. That's what me and Katy, I rant to Katy every day about, which is just that lack of awareness of in the medical world and outside, obviously, a lack of awareness of how it can affect people.
Yeah. Katy, describe the symptoms that you were seeing in Max then, I guess 3 years ago when it was at its rock bottom, and also compare those to symptoms of other conditions because you're a doctor. So you'll be aware that there is a massive crossover, isn't there, in terms of those symptoms?
So mainly he would be doing his exercise still, but he wouldn't be able to do as much as he would normally do, and he would complain about that, and he'd say his legs felt really heavy, so he'd go for a run because he always runs and has always done his weights, and he'd go for a run and be like, some things like my legs are heavy all of the time, I can't run, I can't do it, and that would make him grumpy because the Max's go-to thing always for his mental health has been exercise. So that confused me a bit, whether it was why not exercising was that impacting on his mental health. But the huge thing was his mental health.
Yeah.
He was very anxious, probably like more irritable. But it was anxiety. It was, when it all came to head, it was repetitive thoughts that he had. He was like just very low in mood, very depressed. And when it got worse to a point of feeling suicidal, depressed, which was nothing like Max had been before. I know that mental health can affect people at different points in life, but the thing for me was it happened really quickly.
Yeah.
It wasn't that gradual. It felt like things were gradual from like an exercise tolerance point of view, and irritability maybe, and an energy point of view. I mean, he was napping and lying in. This guy's never laying in his life. It doesn't nap. And it was just things like that. And for me, I originally put it down, when I thought about everything, I thought, like everybody would think, from a medical point of view, I thought, right, well, yes, we've just had a baby, you know, whether we were pregnant with Henry at that time, I can't remember, but we've had stress on, he's had cancer, yeah.
The next couple of months after Henry was born was
when you were really poorly, yeah. But leading up to it, like you've described, Teddy, there was lots of stresses and things that people would say, well, why?
But if someone came to you with those symptoms, Katy, what would you say as a doctor? Would you determine the depression, send them to a psychiatrist? Is that what you'd perceive rather than the physiological cause?
Not now.
No. But I'm just trying to go back to where we were, where other people might be, because you list those symptoms, and I think that sounds like depression, or it sounds like an underactive thyroid. There's loads of other things it could be, maybe.
Yeah, so I would have thought, if Max had come to see me as a doctor, I would have done some blood tests. Would I have included testosterone? Probably not at that point. Would I now? Absolutely yes. And since, in practice, I've picked up several other men who presented mainly with mental health and anxiety and depression and fatigue, those symptoms, who have had a low testosterone, which I wouldn't have done in my panel of bloods initially for somebody presenting with the symptoms like Max did. But I thought Max had anxiety and depression. I also thought he should get his thyroid checked, but Max was under a specialist where he was getting his bloods checked regularly. So we asked the specialist nurse, the urology specialist nurse, to add your thyroid on. Mm-hmm. So we did check this. I said, look, let's check your thyroid. Let's check you're not anemic. Let's check there's no other causes for fatigue that there might be. We added all of those blood tests onto his blood monitoring that he was having for his cancer. So we did those things. They all came back normal. His testosterone was slightly on the low end of normal for the NHS, which I'm sure Max will go into more detail about, but nothing was done at that point. Then it dropped severely low, and it was just like, bang, it was Christmas time. I remember we were supposed to be coming down for Christmas. We did still manage to come down, and Max was just, his mental health was just, he was severely anxious, not sleeping, pacing around, repetitive thoughts. It was really heartbreaking to watch, because I've never seen him do that before. That's emotion.
Yeah, no, that is very sad. It was really sad. This was just before the pandemic as well, wasn't it? Which added another layer onto the complexity, I suppose. Because this was December 2019, I guess, when you came down for Christmas, a few months after Henry was born. How did you feel at that point, Max? Was there a big drop off, or was this gradual? Do you think that you ended up in this pit of despair, I suppose?
Yeah, I think it was kind of gradual in an essence, but then it was kind of like you fell off a cliff, really. So it was kind of like you're trundling down a hill, and then you hit the precipice, and it's like bang. That happened over about a week or two, and that is a classic sign of lack of stress resilience, which is low T related. Now I know that. I think the sad thing, maybe being fatalistic, maybe I'm in this area now and I'm able to help other people, is that if I'd been TRET when I could have been TRET based on guidelines, I wouldn't have gone through any of it. Yeah. In reality, I mean...
So it gives you profound, more kind of meaning and passion for what you're doing now, because you hit the real low, whereas if you'd had it corrected earlier, you maybe wouldn't have seen how significant it was, in a sense, having never got that low.
Yeah, I think I learned a lot. I learned a lot. And I wouldn't have been inspired to learn as much as I did, because if I'd gone down the route of, I feel a bit tired, I feel a little bit irritable, I've got a bit of anxiety, my sleep's not great. And someone said to me, yeah, your testosterone is treatably low, we'll put you on replacement. Then I would have felt a bit better.
Yeah.
And quality of life over time would have changed. You can talk about time scales of sort of improving symptoms on treatment, but I would have never gone, bloody hell, this is important. Do you know what I mean? Because I would have never got to that point of like, I don't want to do this anymore. Like, as in sort of, so that's why I want to bring awareness. And it sounds like I'm sort of, what's the word? Altruistic or something like that, because my testosterone work doesn't pay me as much as my GP work.
Yeah.
But I love it. Because,
it's philanthropic. Philanthropic, you're helping people. It's like,
exactly. But I'm helping people because I have a set of expertise that a lot of people don't have. And so I'm able to, from personal experience and from just hours, days, a couple of years of pretty intense research, which is driven because I'm passionate about it and it doesn't feel hard or like, doesn't feel like work.
So it gives you a unique insight versus being a general doctor, which you've always helped people, haven't you, as part of being a general practitioner. But this is a sort of specific niche where you feel that you offer a particular value to someone.
Yeah, absolutely. It'd probably be incorrect to say that you need to have personal experience of a condition to treat people well, because otherwise, every doctor would be sick as a chip because they'd have to have it.
Yeah.
But I think because when you look at it, testosterone is actually pretty complicated. And certainly the wider view of it being dangerous, being either, a steroid as in terms of, bodybuilding, that sort of thing, or it causing certain diseases, which you have to have that knowledge and confidence that you can say to someone, look, here's the ins and outs of the treatment. And often my patients will actually say to me, which I love, because I have to say, in the first few weeks, you might experience this, you might experience that. And they can say to me, well, did you? And I would say, well, I got a bit of this, I got a bit of that.
Yeah.
And they seem to really.
Well, a lot of counsellors have had mental health problems, haven't they? That's interesting. So they have that sense of empathy, which is, and a lot of people in nutrition have had food disorders when you dig into it as well, which is quite interesting. Katy, this was beginning of 2020, and you, as a family, went on holiday, didn't you, to the Canary Islands? Is that right? And that was kind of rock bottom because Max was suicidal at the time, wasn't he? I think we didn't quite know the extent of it, but what was that like? Because you had a baby less than 6 months old, and then Lola wasn't quite 3.
Yeah.
I wouldn't say I was suicidal as in actively suicidal as in I was going to do anything. I didn't want to be here, which is, I think I just wanted to make that distinction because I wouldn't have done anything.
Well, you're in a lot of pain. Or a lot of pain or a lot of exhaustion? What was the sense?
Mental pain.
It's very mental pain. Yeah, that's the way to put it.
You said to me, how long do I have to live for? And I said, you've got to wait at least 5 years because you can't do anything while the kids are this young.
All right.
I probably made that up because I didn't know what else to say. But I had to give him an amount of time so I could get him better.
Yeah. Wow.
He didn't be like this anymore. So he had to have, he was like, how long do I have to be like this? And the holiday, this was in a time when we still didn't know what was going on. And lockdown for us actually helped because what Max needed to do was stop what we were doing. I was saying, if it's anxiety, you don't want to stop doing things.
Yeah.
Going. I don't want you to become fearful of being able to do things. He had to stop working, absolutely, because he couldn't practice safely, because he was exhausted and with everything that was going on. So he stopped working. And I was trying to get him to do things. I was like, let's go to the beach. Let's do this. Let's distract you. Let's try and get through it. And we talked every night, and, talking about how you're feeling. And actually none of that was what he needed. I didn't know that wasn't what he needed. I thought that was what he needed because I thought he was suffering from severe anxiety and depression. And I saw private psychiatrists. Max started on antidepressant medication. Max had cognitive behavioral therapy. Max did meditation. Max did everything that anybody could possibly do to get better because he wanted to get better.
What impact did they make, if any, Max, those particular treatments?
Mindfulness, so meditation was fairly helpful, gave me a break. That was reasonable.
Because you were having repetitive thoughts, negative thoughts, self-harm thoughts? What was going on?
Not self-harm thoughts. That's why I sort of would like reword the suicidal thoughts in the sense that I wasn't there going to take pills or anything like that. I just didn't want to sort of wake up, basically, which is, I think is different. I think that's different, isn't it? Do you know what I mean? So I didn't enjoy existing, which I think is different It's sort of,
why not? What were you feeling? I mean, it's hard to articulate. I know words don't always express it, but what were you feeling that was so intolerable?
Yeah. So constant sense of fatigue, very repetitive thoughts that would switch between one that would last a couple of days and then move on to another one. And they were fearful thoughts. And in hindsight, they were very much so not trusting myself, which is probably linked to testosterone, to be fair. Yeah, and it was just a constant sense of dread, a lot of adrenaline spikes constantly, lack of appetite, very poor quality sleep even though I was exhausted, achy limbs all the time. And this is quite an extreme version of low testosterone in hindsight. And the reason I know it was low testosterone is because the treatment reversed everything, which is quite nice to have. But yeah, it was just that. The main thing was the constant repetitive thoughts, and I don't like sort of go into the nature of them, but they were, it was very unpleasant, and it was sort of like I couldn't understand it because I'd never experienced it before, and so
how much was the uncertainty a factor for both of you? I suppose the not knowing, particularly as doctors, that must have been quite anxiety inducing for you, Katy, as well.
I think when you're in it, aren't you? And like, I just kept, I suppose I see people with anxiety and depression all of the time, and I have a huge patient load around mental health. I see a lot of mental health patients, and most of them, do get better. So I always had the hope that with the right thing, he will get better. My biggest anxiety was he wasn't getting better. We did everything he should do. We saw a practitioner. We did everything that you should do. He got help. He saw a psychiatrist. He tried medication. Like I said. And nothing was making any difference to him.
It was getting worse, really.
It was, I mean, these repetitive
physically,
thoughts.
I was getting better at dealing with the mental side of things, that's for sure. Because I went back to work and I was functioning to an extent, not enjoying it, but I was doing things.
How much were you sleeping at this time? Because this was pretty epic. Sleep sessions.
Quite a lot, See, that's what I would say the antidepressants, if anything, what the antidepressants did is made me feel quite numb and helped me sleep, which was a big thing. That was quite a relief because when I was asleep, I wasn't hurting, So,
I mean,
did you feel better from the sleep though? Did you feel rested when you woke up? Like, normally if you have a good sleep.
To an extent, yeah, I would say so. I mean, nowhere near how good I feel now each time I wake up.
Yeah. I mean, this is the point. This guy was so exhausted that at one point we had a mattress that needed taken to the dump, right? Yeah. Left it in his car, in his Land Rover in the back, right? This is a GP at work who had a mattress in the back of the car. He took one of
sounds a bit brandy, doesn't it, really?
One of the frozen bed sheets covers, and he would have a nap in his car on a mattress. This is how this person is. Imagine seeing your GP in the car park.
Well, to be fair, we've all had naps in service stations in our car, like just if you're driving the motorway, have a rest, but not quite getting a full bed out and sleeping outside a patient's house. Yeah.
But I because I was in it, I genuinely thought that this is just burnout, and even so I burnt out, and it was about 1.5 years. It was 2 years, wasn't it, before I went on testosterone? I know the time.
What medically happens with burnout then? What is that? A psychological illness or a physical illness?
It's it's not really a medical term, really. I mean, burnout, I think you'd use for someone who's just been burning the candle at both ends and just hits a wall mentally or physically, really. But
not enough sleep, not too much cortisol, too much
stress, a lot of pressure on you. Maybe that was the kind of idea. But I think what was so funny in hindsight, well, it wasn't funny at the time, but I can look back and feel sorry for myself and laugh as well. But I was 2 years, so when I crashed in 2019, the end of 2019, I had 2 years after that where I told myself, I've got anxiety, I've got depression, or, I don't think my depression was as bad as the anxiety, let's put it that way. I've burnt out, and this is going to be me for the next X amount of years. And I would run because I was still, I started exercising. I basically started living in existence with low T, on antidepressants, tried to come off them, went back on them. There was sort of like a history to that. But I was telling myself that this is nothing medical because I'd had bloods, you know. I didn't know that low testosterone could cause any of this. So I was telling myself, look, you're not ill. You just need to crack on. And people would literally, we had friends who'd be like, oh, is he going for a nap again? And they would be like, I just feel really, 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 really tired all the time. But it was kind of like almost became a bit of a running joke that it was just Max, he's lazy.
So what did it feel like flu? Like when you get that overwhelming?
There is a little bit of that. Yeah, very achy legs. I'd go for jogs and my legs would be really heavy. And I would just be a lot weaker in the gym. And the funny thing is, you know, exercise for mental health tends to make people feel better. I felt worse every time I exercised, but because I had that belief that this is what gets you better, I kept doing it. So with low testosterone, you could maybe suggest that the recovery from exercise is not as good. You know, the cortisol that breakdown that you cause would affect you, you know, so.
And also feeling, you've always done resistance training, feeling like you weren't progressing strength-wise or regressing. How dispiriting was that at the time?
That was the least of my worries, to be honest. I mean, the funny thing is I was taking pictures of myself and I was trying to do more exercise, and I was
not that you stopped.
No. I was just getting fatter, like as in I was losing muscle on me delts and me biceps and gaining fat around my belly, and I was like, what's wrong with you? But I was like,
is that a symptom of low testosterone, body change in spite of exercise?
Yeah, so big one is belly fat and loss of muscle. And you could, as well as that visceral fat, you don't see that, but that's fat around your organs, which is quite bad for you. So yeah, I look back and I feel a bit sorry for myself because I'm like, I literally had to tell myself that this is psychological. And so, you know, you've just got to crack on, buddy. And
so it's Kate, how do you stabilize, Katie? Were you feeling better before the testosterone diagnosis, the shortage of testosterone, or were you feeling like this was just locked in a bit of a nightmare in the lockdown in 2020?
The one thing the lockdown did, which helped, was it stopped us being able to go out. So I stopped being able to distract Max, because what Max needed actually was rest.
Yeah.
So because it was not anxiety, there was obviously anxious symptoms. There was symptoms of anxiety, absolutely, but it wasn't just an anxiety and depression where he needed to keep a routine. He needed to actually sleep because he was completely exhausted. So that was funny. In the lockdown, we brought a mattress down into the sitting room, because this is the point. So because he would sleep so much.
Just moving mattresses all over the place in this house.
So because I had a new baby as well. So, you know, Henry was only a few months old. So Max would nap, and then I'd put Henry in the bed with Max. So it was like, he would like, so, and then Lola could come so that they would spend time with Max still, because he would be in bed a lot. So made it a thing, made it like, you know, I mean, he used to call Max the sleep hog.
Yeah.
Where's Daddy? Oh, he's the sleep hog. He's sleep. So we just made it like this is normal now for us, because I don't know what else he can do.
What did the psychiatrists and the cognitive behavioral therapists say to you, Max? Did they determine a problem that was psychological, or did they not have any answers?
Yeah, they just said you got, you know, mental health condition. Here's some advice.
They were really good.
But the therapist presumably was trying to talk to you about, well, cognitive things, behavioural things that you could change. But were they just didn't help, or?
I mentioned to the psychiatrist about the testosterone, and it just wasn't good.
But you weren't feeling that the therapy wasn't helping. Like talking to someone wasn't actually. That was another sign that actually this is something different than normal depression.
Yeah, I just thought, you know, maybe just very resistant to treatment here. You know? So yeah, I mean, no, it just nothing really worked. I got to a point where I just carried on, and I think sometimes that can be helpful, just to say, carry on. You know, in a lot of circumstances, I think, you know, I needed to rest and I needed to try and maximize sleep possible, but I got to a point before the testosterone treatment where, yeah, it wasn't great, it wasn't pleasant, but I was living. Do you know what I mean? I was working, I was, you know, looking after the kids, I was playing with them and doing everything fairly normal. I wasn't enjoying it. That's how I would put it. And, you know, I still had remnants of very repetitive thoughts before the testosterone. I still had a lot of the symptoms of low T, but I'd got to a point where I'd kind of just accepted things as they were.
Yeah.
just said, right, well, there's no point lamenting with that? I mean, there's no point sort of just
lamenting works. Yeah.
Just crack on. And that's what I ended up being like, basically, which was, wake up, try and sneak a nap in the middle of the day, but just go about normal.
But you must have felt pretty exhausted as well, Katy, at the time. So it must have been hard for you to get a clean handle on everything because you had 2 babies and a job.
Yeah. It was, I can't even describe it. I was exhausted because also I was sleeping so that Max could get a full night. So I was sleeping in the bed with the babies, which is why I made my room of 2 beds pushed together. So
it was all an excuse just to avoid parenting at this point.
For you.
Yeah. Just get rid. I was just like, you do that, I'm going to fake illness here.
He had to sleep, had to actually get to sleep at night time. And Max was working more hours than I was. So, it was just really hard. I just wanted Max to enjoy living again at this point. So this was a point when he was functioning, but I knew he wasn't there. He just wasn't there. So there was no. He was present, but there was this nothing behind the eyes. It was what it felt like.
Numb.
Like he was just numb. He was completely numbed, and he was still fine. He still had the kids. He was, like you said, he followed all of the routine that you should follow, but there was it didn't seem like there was any enjoyment in anything that he was doing, not even exercise or nothing, but he did everything. Mm-hmm. He just kept going. So it just felt for him that this was life now. I've just got to just keep going. And I just was trying to work out what else can we do. Does he need to increase his medication? Is it, and then for a while I was like, maybe the medication's making you feel numb. Do you need to reduce it? So we'd often, and we shouldn't treat each other, but I would say, do you think we should think about, and I would think all the time, I'd look everything up and say, shall we reduce your citalopram because you're on 30? Should we reduce to 20 because maybe that's why you're not feeling enjoyment because you're actually taking too much, and then we'd reduce, and then that wouldn't work, and then we'd and then things will come off. And it was like constantly looking for what the missing jigsaw piece was, and it was testosterone. And it was because Max had an appointment with an endocrinologist about his testosterone, a private appointment. That was our last straw. We said, right, just let's ask them, because it was the low end of normal. It was our last chance.
No, it was abnormally low then.
Was it? It was like
ticked a box.
Low. He ticked a box.
I went into the red zone, which was
so we sourced it privately, and the endocrinologist went. It was on a Zoom call. We were there, and he said, "Yeah, your symptoms are probably just low T." And we were like, "What?"
No, he didn't use the word T.
Oh, low testosterone. Well, that's what he said, didn't he? And I was like, what? And he's like, yeah, it's probably just all of it, all of everything you described, probably low testosterone. And I was like, well, no, can't be, because we've just gone through 3 years of hell.
So when was this then? How long had the dark times gone on? When was this? Because this is kind of a good point in a second to wrap up this conversation, because this is where the ray of light came. How long was this, and what prompted the endocrinologist visit?
So I didn't know too much about testosterone range, as in the guidelines, the exact guidelines. I would always assume that it was only if it was red on the blood result that it was significant, which is in hindsight not correct, with testosterone, sorry. So that was probably about 2 years after. So I started, so about 2 years after that real wall that I hit in December 19. So it would be
2021.
Yeah, so the very tail end of 21, wasn't it? So I've been on testosterone replacement now for about a year and a half. So that was the point at which the blood test went below normal. We started to do a little bit of digging ourselves into testosterone, and we thought, this could help. This says here it causes low energy.
Yeah. Was this a bespoke blood test you were taking, or was it one that was a cancer follow-up that was standard NHS blood test?
Not standard cancer follow-up, because I kept asking for it to be done, because I saw that it dropped and I was tired, and I knew that low testosterone could cause tiredness. I didn't know about the rest of it. Yeah. And so when we saw the endocrinologist, it was very much like testosterone might improve my energy, was my thought, and that's what Katy thought. And then when I went into the symptoms with him, that was when he said, you could just have low testosterone,
Did you didn't believe him at the start?
Didn't believe him. No. Well, you did a little bit. At least you told me.
I was like, yes. I didn't believe him in my head because I thought, come on, it can't just be that. But Max needed hope, and I was like, this is it.
Yeah.
This is the one.
Yeah.
Found it. This is what's wrong. This is what's been wrong. And it literally was what was wrong. It literally was.
And then what were the scores? Because it's a digit you get, isn't it, for testosterone? Is it nanomoles per milliliter or something? Is that how they measure it?
Nanomoles per litre is the UK valuation. This is a bugbear of mine, but it's not the lab's fault necessarily. But the ranges are dropping of what we consider to be normal, and that's just representative of population decline in testosterone. 99% of which won't be testicular cancer related. So that's what I want always to point out, is that my start is not the same as everybody's.
Yeah. Well, that could be a general podcast episode we'll do later on. It's about the societal drop in testosterone among things. So that will be a topic. But what's curious about this is what was your digit and how difficult is it for people to know? Because I suppose, as you're sort of hinting at, it's very personalized, isn't it? Because actually, whether you have a generic red zone for people is fair enough, but actually where it is relative to what your baseline is the key. And you don't know that if you haven't had blood tests when you're a young man.
No, and there has to be a certain nuance to the treatment as well. But yeah, so the range can go from 6.6 in some places in the country to 30.
That's normal. That's normal range. That's
the normal range. But it used to be 9 to 30, let's say, and about 15 years ago, the top end was higher. Yeah. So there's been a massive decline, pretty significant even over the last 20 years. But my levels went something along the lines of, so a year post-surgery, and this is, I might not be exact here, but a year post-surgery, my afternoon level was 14. So if you backtrack to the morning, it would have been higher than 14. Mm-hmm. Very likely. I don't know how high.
You had a 21 level at one point.
Yeah, I can't.
You had a morning level done that was 21.
Right. Okay. Well, so 14 in the afternoon, and then subsequently I had one morning level which was 12, which was treatable. Yeah. So that would have been, if you use the British Society of Sexual Medicine guideline, that was treatable. And I didn't get treatment because it was not red. And then when I got treatment, it was 8.3 and 7.8, something like that. So that's when.
Do you know what your level would? Have you got any estimation of what your level would be before the testicular cancer? What the normal level would be? Is there a calculation you've been able to figure out, or just to get a rough guess where you would have been?
You can't tell really. No. All men will run at different levels that are normal for them, and I think that Max's, when it was at 21, even at 21, that's the high end of normal, isn't it?
How were you feeling at 21 when those? Were you still having symptoms of depression?
Yeah, that was pre. That was
just after he'd had his operation.
That was just like I just said I felt a little bit tired, so she checked it really.
That could be as normal.
That was probably baby tiredness. That was.
I'll tell you what. Let's wrap up this on a sort of positive note, because it's been quite a dark conversation. But let's talk about the first glimmer of hope and how the things changed, because you started to believe in what the endocrinologist had said. What were you prescribed at that stage? And we'll ask Katy in a second what her observation was and the change in you. But what were you prescribed, and what was that feeling like when you started taking testosterone, or rubbing it on was the first thing, wasn't it? Is that right?
Yeah. Often what they'll go for in the NHS is a gel, and then maybe switch it to long-acting injections. And we can maybe do a chat about, actually what is potentially gold standard treatment, which is slightly different. But I'm not going to begrudge the gel, because it did make a difference to me. So I would say, started on a gel. You start on X amount of pumps a day, and that can be upped depending on your blood level.
Rubbing the gel where?
I think I was doing my delts.
On your thighs? Yeah, you're rubbing it on your thighs.
So ideally it's a hairless area that's not going to be exposed, because obviously there's a contamination issue if you've got young kids, or even a wife or partner.
Yeah.
I've had patients who've stayed in the same bed as their partner who's rubbed it on their leg, and their wife has had some hair growth on her.
Oh, wow.
So okay. Transference from your partner. So
yeah,
sort of the light bulb moment for me was actually about 2 weeks in. And this is what I tell guys who start on TRT is it's not a cup of coffee. You know, you're not going to take your first injection, which is often what I'll prescribe, and you know that day or 2 days later you're going to be running a marathon and feeling constant erection and libido through the roof. So it is a time, it is a sort of, you have to give it time to take effect. And that's because I've experienced it myself. And about 2 weeks on using the gel, I would say maybe a little bit sooner, I was jogging. And I remember I was jogging and suddenly my legs didn't feel so heavy. And I got back in and I said to Katy, my legs don't feel as heavy.
Your weird hybrid accent. I don't know what E is. Yeah.
True Geordie to the bone. Sure the listeners can tell by the accent. But so that was the first thing, was a little bit more energy and then a bit more mood elevation. And that was over a period of weeks, really. And I'm not going to lie and say that it happened within 4 weeks, 6 weeks. It was very gradual, but it was curative. And I suppose when you've been in a bad place, when you start seeing the light, you're like, what's going on here? And then, so basically for about a year and a half now, I've basically constantly read about testosterone.
Well, we'll do more in the second part about your return to normal for a Draper, normal for a Draper man anyway. But let's quickly, Katy, what he says 2 weeks that he felt in his legs. What did you see? Because you said you saw a numbness behind the eyes before. Did you notice some sort of glimmer of light and energy come back to him?
He came in from run. He's like, oh, my legs. They're not injured. And I was like, and it was the first time he'd been excited about something. So that was the very first bit. And the thing, it was the thoughts. The repetitive thoughts was always like my monitor of how bad or good he was doing. So even when he was getting better, it would be, was it 1,000 times a day that thought repeated in your head, or 1,000 times a minute, or that, there were, how frequent they were was my gauge on how unwell he was feeling. And the frequency reduced dramatically over weeks. And it was over weeks. It was over like 2-3 weeks. You were like, I do have a thought, but I can rationalize it. And it's in my head, but it was like 5 times today. And before it was like 1,000. So it was a huge change. It was still there, but you said my brain isn't doing this anymore. I can keep it still. That was how you decided. You could focus on it and you could say, this is an irrational thought, and put it to one side. Whereas before there was so many, you couldn't pick to focus.
Amazing. So you get separation. You get separation from your thoughts. Why? I mean, why does that happen? Do you know why that happens? Why testosterone will affect repetitive thought, reduce repetitive thought?
It's essentially, and it does get quite complex, but the hormones, including testosterone and obviously DHT and estrogen, do have an effect on your brain. Various effects, in terms of sort of, things like confidence, desire to get going, that drive, that sort of cognition. So there's even evidence about how well your brain functions. Things like, they've done studies on dementia and things like that with testosterone treatment. But the main thing probably in my scenario was the fact that it does affect your dopamine and serotonin system, the hormones. Your sex hormones have an effect on probably levels, but also how effectively those receptors.
So motivation and focus, feelings of wellness,
calm, motivation, focus. Mood elevation. I mean, there's really good studies on testosterone and depression. There's most research is pretty conclusive that it's anxiolytic, so it reduces anxiety down, as in the treatment. And then you look even more further afield into the idea, well, my stress resilience was rubbish. I had to sleep all the time. I couldn't really physically and mentally cope with as much stress as would be normal for me. And there's that balance between testosterone and your stress hormones, so your cortisol. And I think people get this impression of testosterone being kind of like, roid rage, sort of, I'm going to go out and do, bad things and attack people, or, But actually, it
just amplifies your normal tendencies, doesn't it? I've heard it described as. So if you're an aggressive person, it'll make you more aggressive. But if you're not, it doesn't.
Well, the dose, the poison's in the dose, isn't it? So if you get your testosterone at a good level, the vast majority of people, will feel calm, have good perspective, feel driven, feel pretty confident. Obviously, there's personality traits within this. So
yeah, relative to yourself. Yeah.
Yeah, it's going to improve these things. So
the big fact, though, is Max is replacing what he doesn't have. It doesn't have enough of, exactly. So he's replacing it to a level that's right for him. If you're replacing above, or you're taking testosterone outside of testosterone deficiency, that's like a different story, isn't it?
Yeah, absolutely. Yeah.
Well, absolutely. Yeah. Well, let's wrap it up there. So let's conclude this. The next part will be about your kind of rise, and it's amazing when you actually put the timescale on it, how recent this has been. This has been the start of 2022. Really, this is where we wrap up, is it, Max? This is where you get those first foothills of recovery. You felt for the first time in a long time, you start to feel brighter. Is that where we leave this conversation, do you feel? And then we'll come back and pick up the sort of the more escalated return to quote unquote normal.
Yeah, go through the road of recovery into becoming a sort of self-educated specialist in it,
Yeah. And then, so going back, Katy, just over a year, did you feel like that was a seismic breakthrough, sort of early 2022?
Absolutely. And it changed. It's definitely changed our lives. I did settle into the fact that my life and Max's life was going to be what we've described. That was, and we took positives from that at least he was functioning and he was managing to work and he was spending time with his kids. But like, to go from that to where we're at now, and all of the things that Max has now achieved and achieving, and the fact he's helping other men and their partners and families who are going through very similar things. It's just really important to both of us to get that message across, and just to provide, just a normal chat about things. And
Good to have you. Good to have your husband back as well, I guess, is the big thing. So, well, let's leave it at that conversation. We'll part 2 will be kind of early 2022, first foothills of taking a testosterone therapy, and then where we are today, different types of therapies, and over the past year, and how it's impacted you, and indeed how you're now helping others and impacting others. Katy, Max, thank you for now.
Thanks,
cheers, Eddie.
Have a good one.